So here's a look at the hospitalizations when it comes to COVID-19 cases across South Carolina. These are the numbers that are coming to us from DHEC. 542 patients are currently hospitalized. 133 of those patients are in the ICU. 66 of them are on a ventilator. So how do these numbers compare when we were looking at peak hospitalization numbers during the pandemic? Hospitalizations peaked in December. As we started that month, we had fewer than 1,000 cases, but by mid-January, we reached the all-time high of 2,466 hospitalizations. And on January 12th, for ICU patients, 485. But then we began to see a slow decline. In February, hospitalizations fell below 1,000. Again on February 22nd, and they've stayed below that mark and have continued to fall for the last few weeks. However, in the last 2 weeks, that number has only plateaued. Our Kaylin Hagwood spoke with the South Carolina Hospital Association. She has the latest on these numbers.
After a challenging year for hospitals, a promising sign. Fewer people are being hospitalized for the coronavirus in South Carolina, giving staff more room to breathe. John Williams is with the State Hospital Association.
Hospitals are in a much better position than they were earlier on in the year. Surge has dwindled down a bit. Hospitals are still seeing COVID patients. However, it's much more manageable.
He believes the vaccines are a big factor.
But also, I believe it's in part individuals following the CDC guidelines.
The news comes as restrictions continue to loosen, raising concern for a possible rise in cases.
You see a lot of large gatherings and really don't know what to make of it thus far. There's always concern of another surge due to everyone not having access to the vaccine right now.
He says the biggest factor for hospitals is expanding vaccine access, despite an inconsistent supply. Until more people get vaccinated,
continue to adhere to the guidelines. Please get vaccinated when your number is up, and we will get through this together.
For the News 19 vaccine team, I'm Kaylin Hagwood.